Guidance for colonoscopy. This video is made to explain what colonoscopy is, why and how it is conducted, and what precautions should be taken for a successful procedure. The instructions to be given in this video should be fully followed by clients for a safe examination. Purpose and effects of examination. A colonoscopy is performed with a fiber optic camera on a flexible tube passed through the anus. It allows visual inspection of the inside of the colon and rectum to detect any inflammation, ulcers, and abnormal growths in the intestine wall. Polyps are common in adults and usually harmless. However, 95% of colon cancer begins as a polyp. Therefore, colonoscopy is a procedure to detect precancerous polyps earlier than any other test. If any suspicious lesions or polyps are found during the procedure, an endoscopiist obtains their specimens or removes polyps during colonoscopy. Many doctors normally recommend screening examinations every 3 years after age 40 for early detection. If a client has family history of colon cancer, inflammatory bowel disease, or other risk factors, he needs to start the examination earlier. If a colon polyp was found before, a recheck is recommended in 1 or 2 years. The colon is a long intestine with hard curvatures, so when the instrument is inserted into your body, it can make you feel painful and a little uncomfortable. Some clients can awake from sleep during the test, so deeper sedation may be required in some cases. When the client chooses to be sedated during colonoscopy, he is given a sedative injection right before and falls asleep during the procedure. Unlike those under general anesthesia, sedated clients can still have consciousness and respond to verbal orders or light stimulations of an endoscopist. Some clients can awaken during the procedure. But clients under sedation feel less pain and do not move their body around excessively, allowing a more rapid and accurate examination compared with those without sedation. However, there are clients who need to take caution for the use of sedatives. The elderly, age 70 or more, clients with lung disease such as asthma and emphysema, and kidney or liver failure, pregnant or breastfeeding women, are not recommended for sedated colonoscopy. Preparation before examination. Tell the medical staff in advance about your medical history and current health status, allergies, medication for a safe examination. Inform the medical staff of your current medications and ask if you should stop or continue your medication. From the night before the procedure, you need to take a laxative solution and abstain from any food. This medicine is to loosen stools and increase bowel movement to empty the colon for an accurate test. See the separate video for how to prepare bowels for colonoscopy. Before the examination, remove dentures or jewelry and store them safely. It is recommended that the client be accompanied by a guardian because unexpected situations can occur during the examination or a client may need help post-procedure. Procedures and methods. Colonoscopy usually takes 20 to 30 minutes. But if the bowel curvature is unusually hard, our specimens are taken at multiple sites. It may take longer. For a safe and accurate procedure, injections are given to relieve pain and suppress bowel movements. Clients may experience blurred vision or increased heart rate temporarily after the injection, but these are brief and expected reactions and should not be the cause for alarm. Intravenous lines are connected to administrate medicine and fluid. Lie on the left side, as shown in the picture, and bend knees up to the belly. Now, sedatives will be injected into the vein. The physician will first palpate the anal canal and the rectum with fingers to determine whether there are any abnormalities. The endoscope is then carefully inserted and moved up through the rectum, sigmoid, and cecum, the beginning part of the colon. Now the tip is handled back downwards to inspect the wall and find any abnormal growth. If there are any suspicious lesions detected, pictures are taken and specimens are obtained for microscopic examination. And the biopsy results come out in 1 week's time. If small polyps are found inside the colon, they are removed right away. But if they are too big or certain complications are expected by removing them, just specimens are taken without removing them. Depending on the biopsy results, doctor will decide how to treat them. Precautions during examination. Be sure to follow instructions for a safe and accurate test. A client may have a stomachache as air is introduced into the bowels for a smoother passage of the tube and a better view of wall lining. Trying to be relaxed and taking a deep breath are helpful during the test. As the tube travels through and stimulates the bowel, you may feel bowel movement or a sensation similar to passing gas. If you feel like it, just let it go. You may be asked to change positions for a better passage of the tube. Precaution after examination. Following the examination, clients take a rest for about 30 minutes. However, clients may continue to feel dizzy or lightheaded after the rest, so clients are advised to be accompanied by a guardian. Clients should avoid handling dangerous equipment, driving for themselves, or making important decisions following the procedure. Client may experience bloating due to the air injected, but the discomfort subsides in 3 to 4 hours as gas comes out. Warming the abdomen, taking a light walk, or lying on the stomach will help the gas out. There can be pain or blood spotting around the anus as it was irritated by the tube, but these symptoms disappear soon. Sometimes, after removing polyps, hospitalization may be required for 1 day to monitor any complications depending on the size and type of the polyps. Post-procedure, clients should avoid alcohol, hard working, spicy food, and vigorous exercise for 3 to 5 days because mucus layer needs the period to heal itself. Complications and side effects. Colonoscopy is a relatively safe procedure, but sometimes you may face some complications due to the use of medication and the procedure itself. Hypersensitivity due to medication. Dizziness, urticaria, asthma can occur as an allergic reaction to the medication injected for a safe procedure. Local complications. In rare cases, after returning home, clients may have hemorrhage or perforation at the biopsy site. If you vomit blood, experience severe abdominal pain or hypotension, be hurried to the emergency room. General complication. Elderly or those with risk factors may experience arrhythmia, heart attack, hypoxia, pneumonia, stroke, etc. Even if those are very rare, they can be fatal. Examination failure. Colonoscopy cannot be performed when the bowel preparation was so poor that solid feces are still on the bowel wall or bowel curvature is unusually hard, limiting the passage of the tube up to the end of the colon. Plus, some clients are not sedated enough even after sedative injection, and sometimes the half-sedated client would not be cooperative with instructions. In these cases, the endoscopist cannot proceed with examination. In rare cases, some clients develop dyspnea, hypoxia, hypotension, or other conditions, halting the procedures for safety reasons. Diagnostic alternatives. If you failed the colonoscopy, you can try colonography with X-ray imaging or colonography with computed tomography, using the barium as contrast. But these examinations cannot replace colonoscopy, as the inner wall of bowels can directly be seen through camera, and biopsy is possible for a more accurate diagnosis. Now we have briefly reviewed about colonoscopy and precautions for a safer and successful procedure. Thank you.